So our next presenter in today's program is a co-presentation. So Alex Buchanan, along with Dr. April Noon, will be presenting on Indiana University's Interprofessional Education Center's effort on combating the substance use disorder in Indiana and the wonderful COPAC clinic at IU.
Hello, everyone. My name is Alex Buchanan, and I'm the project manager at the Indiana University Interprofessional Practice and Education Center. In my big position, my big job is the leveraging interprofessional education to improve training for future health professionals in pain management, alternatives to opioids, and better prescribing practices. My background as far as education goes, I have a Master's of Arts from Executive Development from Ball State University and earned my bachelor's degree from Indiana University.
And good afternoon, everyone. I'm April Newton. I am Alex's colleague in our Interprofessional Practice and Education Center. I'm the director for Interprofessional Practice Development. And I am a doctor of physical therapy by training, and I'm working toward completing my PhD studies in interprofessional healthcare studies. So I'd like to turn it back to Alex for him to share more about his role in the Grand Challenge.
Thank you, April. Thank you. And for those watching this video, some of you may or may not have heard of the Grand Challenge. So I want to do a brief overview. And back in the year 2017, President Mike McRobbie for Indiana University made a significant investment into addictions-related content throughout the university to assist in addictions-related content throughout the state of Indiana. Back in 2017, over 49,000 opioid-related deaths occurred in the United States. Out of the 4.5% population that makes up the entire United States, over 80% of opioid consumption was done within the United States. And those are just some statistics to give kind of an overview of how addiction has really impacted our entire country, but Indiana as a whole, and not only addiction, but specifically opioid use. And what this project does is try to educate future health science students on how to better screen, recognize, and address substance use disorder and overdose. And some of you may have heard there's a number of Grand Challenge projects that go on throughout Indiana University. And I'd say what makes our specific project unique is that it's housed in the Interprofessional Practice and Education Center. And the IU IPE Center, that's what we call the Interprofessional Practice and Education Center, has the primary objective of educating health science students and students throughout Indiana University to better understand each other's future profession. So when they enter the workforce, they themselves can be better professionals. So what's fun and exciting about this project is we get to work with a wide variety of different health science students and work with them under this umbrella of interprofessional education and substance use disorder awareness. This project in particular has 4 big pieces that we call the aims. There's curriculum, workshops, community engagement, and dissemination. Our curriculum, the foundation for our curriculum aim is what April and I call our curriculum inventory, where we have identified curriculum experts in each health science school in IUPUI and some Bloomington campuses to get an idea of what's required in elective course content that pertains to substance use disorder. In addition to finding required and elective course content, we've tried to understand and find out if there's motivational interviewing in the curriculum, if there's naloxone training in the curriculum, SBIRT in the curriculum, and those are just a few items to name some of the curriculum inventory that we've done and helped develop. Our long-term goal is to house some of this information on our website. So if others are looking to do curriculum inventories similar to this, we can kind of be a stop for them to access. Something that I'm really proud of from the curriculum inventory is after seeing some of the work we've done and some of the work that we've collaborated with other individuals, we are able to take this work and work with the IU School of Medicine on what's called the Community Health Improvement Project, which is a part of the School of Medicine's curriculum where we helped identify gaps within their curriculum. And then we are able to participate and assist with the Community Health Improvement Project, which is a 3 to 4 sessions a year statewide initiative that School of Medicine does with their students on educating them on public health. And they saw some of the work that we've done with the Grand Challenge, and we're able to incorporate that with the Community Health Improvement Project and with the Grand Challenge. So that's something that we're really proud of, and the curriculum inventory that we did was a big, big part of it. The second piece is workshops. So our workshops are split into 3 different tiers. There's workshops for future prescribers, workshops for the frontline workforce, and then finally our comprehensive pain assessment clinic. Now, April is going to talk in depth about our comprehensive pain assessment clinic after I finish my overview of the Grand Challenge, but I do want to talk a little bit about our prescriber workshops and our frontline workforce workshops. So our prescriber workshops, the main area of focus is pretty self-explanatory. It's educating students that are one day be prescribers, have patients, and they can prescribe medications such as opioids. So in those workshops, it's a little more of a detailed, nuanced, in-depth conversation on chronic versus acute pain, how to possibly identify patients that might have substance use disorder, and start those difficult conversations with a patient that might have substance use disorder. And in some of those workshops, we've done experts, motivational interviewing, and had those in-depth chronic and acute pain sessions and talks with chronic and acute pain experts. The frontline workforce workshops are really dedicated to give baseline knowledge to students that we know once they enter the workforce will work with individuals who have substance use disorder or whose family members have substance use disorder. And this consists of students from the School of Education, School of Nursing, School of Social Work, and School of Public Health, just to name a few. And what April and I have done is develop what we call the Grand Challenge certificate series, where if students attend 3 out of 4 workshops in the academic year, they earn a certificate of completion from the IU IPE Center. And these frontline workshops usually consist of naloxone training, referral to treatment, so educating them on the referral to treatment options within the state of Indiana and in their community. We've had children living with parents who have substance use disorder workshops. So a lot of different sessions to help hit home the different arms and aspects that substance use disorder has on society and the number of individuals from all over the world and all walks of life that it impacts. Those are kind of the big pieces as far as the workshops go. And once again, the third one, April will touch on with our clinic that we do. Our third big piece is called community engagement. We realize that substance use disorder impacts different counties and different communities differently based on the resources they have, the access to care they have, and the funding that they have. And what we do with community engagement is try to engage and get to know folks in different counties and understand what kind of needs they have and how we as a university can assist them and empower them to help their community with regards to substance use disorder. Some of the work that we've done in terms of community engagement is we've coordinated what's called the Delaware County Substance Use Disorder Symposium, where we had a wide variety of panelists talk about resources in Delaware County and how we, both at Indiana University and some of my partners at Ball State University, can help that community and understand what are their specific needs. And that's just one of many of the examples that we've done with community outreach. We also have what's called the Center for Rural Engagement at Indiana University, and we've been working with them in trying to identify some of the rural counties and seeing how we can help those and help those communities as well. And for those of you interested in a little more about the community engagement, please contact me. I believe April and I have provided our contact information here. We're all about understanding some of the challenges you face in your community and your county and what we can do. How can we help support you? And also, how can we help educate our students so they're better prepared to work with the community members and the folks in your counties? The fourth piece is dissemination, and that's sharing our findings and sharing our results from our clinics, sharing our results from our curriculum inventory, and sharing those from our workshops. Some of our dissemination has included the Collaborating Cross Borders Conference, which is a interprofessional educational focused session, and also the Indiana Rural Health Association Conference. Those are just a couple of some of the presentations that we've done where we want to share our findings and also network with people both in the state of Indiana and throughout the country and see what are the best practices, what's working, what can we improve on, and so on and so forth. So those are the 4 big pieces. And as I just mentioned, you're going to have April's and I's contact information. So if there's any more information you'd like from some of the pieces of the grant that I just talked about, or if there's some community engagement opportunities that you'd like to discuss, feel free to contact me and we'd love to work together. And without further ado, I'm going to now give my colleague April D. Newton an opportunity to talk a little more about the clinic.
Thank you, Alex, and thank you for the great overview. I know people are going to be interested in maybe having some questions and answer, or for us to answer some of their questions following our presentation. So what I want to do, as you heard Alex speak of some startling statistics, I want to start mine off with sharing with you that if you will, think about how the United States makes up about 4.5% of the world's population. 4.5%. However, we consume over 80% of the world's opioid painkillers. That's just startling. And in Indiana, our prescribers wrote over 109 opioid prescriptions per 100 people in 2012. Now, again, that's a very late or long ago statistic, but the impact of it is phenomenal, knowing that where we are as a state with the consumption of opioids of our community citizens, maybe our neighbors, our family, and our friends. So what we have done at the Interprofessional Pain and Education Center, back in 2018, a group of clinicians and faculty and staff actually started thinking about the process of developing what we currently call the Comprehensive Pain Assessment Clinic. And that goes by the acronym COPAC, and I will refer to COPAC. And they did a rapid improvement session to be able to determine how can we recreate a clinic that they currently had at our IU Health Family Medicine Center, which was a pain clinic, into a comprehensive pain assessment clinic. And through that process of about 6 to 8 months, we were able to actually initiate in January of 2019 an interprofessional assessment clinic. And so you ask, what's the difference? The pain clinic was more of a multidisciplinary clinic and only had 3 different providers within that clinic: medicine, behavioral health, and social work. Whereas the current clinic actually has 7 different disciplines. And to enumerate those, we have behavioral health and marriage family therapy, medical assistance, medicine, pharmacy, physical therapy, social work, and our latest addition has been dentistry with an orthodontist. Prior to and in between the COVID, we actually had nursing and occupational therapy, but currently do not have those disciplines for a variety of reasons. So with the interprofessional approach, what we are looking at is how we bring groups of people within different disciplines, or learners and faculty preceptors within these different disciplines, and we actually see patients that are experiencing acute pain or chronic pain, and we see them in pairs. So for instance, myself as a physical therapist may be entering the patient room with a physician, or I may be entering with a social worker. And during that timing, we will ask of that patient a variety of questions to get their history and get an idea of how they're exhibiting pain, how they're presenting with pain, and what are some of their goals for us to be able to consider in the plan of care that we look at in a very comprehensive way after each of the different professions has been able to meet with the patient. In March of 2020, unfortunately with COVID-19, we had to suspend the COPAC. And that's very difficult because we were all concerned about where were our patients going to be able to go and be able to receive this assessment and or treatment. And the beauty of that is we're housed in the Family Medicine Center, which is our family medicine residency center of education. And so all of our patients that would have been coming to COPAC were able to be absorbed by those family medicine residents who also treat them on a regular basis with other ailments and other conditions and refer them to us. So the good thing is that they didn't go without seeing a provider or being able to talk with a provider. So currently we've been working through this summer on how are we going to reopen this clinic and what will it look like, and will patients be able to be there, and or do we see them via telehealth? And we really grappled with a lot of these different questions. And so in late August, we are going to be reopening the clinic with a hybrid model. So we are going to use different aspects of telehealth and telemedicine and be able to have many of our faculty providers and our learners at a distance. So they will be on computers in a safe location, and they will be Zooming in, as many of you know, in the way that we're probably providing this conference. And there will be a few of us that will actually be in the clinic. And we will be doing the assessment of the patient. Others will be able to hear some of that assessment. They may not, but what we do with that, we'll have handoffs. And in Zoom, if you've been in any of the conferences or in meetings where you can go into breakout rooms, and then there's like a waiting room. So in that waiting room, the providers and learners will pass off information before they go in and see the patient with another provider. So it allows an opportunity for this discussion to continue to play out and have an ongoing communication of the patient's problems and the patient's issues, so that after we've all seen the patient, we come together and huddle and we discuss the patient's major concerns, what are their goals, and then as a team, we determine what are the top 3 aspects of care that we can implement that we feel the patient can safely be able to adhere to. And many times, one of the top ones is something to do with pain, and whether it's medication or a non-pharmacological approach, such as a referral to another discipline or something like that. And then we also consider other aspects of their goals and how we may be able to assist them into attain those as well. So that's our goal, and that's our hope for being able to get this clinic started again and be able to offer our patients more opportunities to see a wide variety of providers. So let me delve back into a little bit of what I mean about interprofessional team-based care and why are we doing that? Well, in 2010, the World Health Organization put out somewhat like a proclamation, and there's a definition of interprofessional education as well as interprofessional collaborative practice. And you can insert words into different places, but for education, and that's what we do with our learners on campus with our health science students, it's when 2 or more students from different disciplines come together to learn about, from, and with each other, to promote higher quality of care for the patients that they will be seeing. And so if you insert healthcare worker or healthcare provider, we pretty much do the same thing. And what we're doing is putting that together into interprofessional education and collaborative practice. So we offer our students an opportunity to learn with seeing patients in a clinic, and especially patients within and are experiencing acute and chronic pain, because this is a very difficult patient population to see, because many of these patients also come to us with other types of ailments and pathologies, because we know that diabetes can cause pain. Maybe having trauma that causes pain on top of having diabetes, or having a heart condition, or having another type of genetic predisposition that also could be painful for them. We're trying to figure out and determine how can we alleviate as much as that pain as possible for them. And so learners are able to also work together and see the different clinicians working in practice and how we talk and communicate to be able to come together and provide that type of service. That's one of our many team-based care clinics that we are currently working toward opening. We currently have 4 at this time. COPAC is the one that is a part of the Grand Challenge, and we are going to be able to continue working towards sustaining this clinic after the Grand Challenge grant has sunsetted. So that is the end of my presentation, and we are open for questions from the audience.
I know there's been a few questions coming through the chat window during your presentation, some of which you have addressed directly within the chat, but different questions about how to get access to different naloxone resources, and a lot of different resources around our state through Overdose Lifeline, through Ship Happens on Facebook. We also have training coming up hosted by your team. Our next one is this Friday at noon, where at the end you would be asked for your address, and naloxone would be mailed directly to your venue. Is there anything else you'd like to add, Alex or April, around those activities coming up here in the next few weeks?
Alex, I'll take that one.
Yeah, I'd say not necessarily on my end, other than if you have the opportunity to sit in on our part of the project, if there's any opportunities for collaboration that you're interested in, or just having a little more details about our project, we'd love to connect with you. And just once, like to echo April, thank you for this awesome opportunity.
Sure.
Wonderful. Any questions from our audience, please, now's a great time to chat that in or unmute your line. So any questions from those who are with us today? Dr. Anwar, do you have any questions?
I have a question. I was listening onto your COPAC clinic. I hope I said it right.
Yes.
It is interesting that pain, which was simplified so much as just a vital sign back in the day, and which led us to this opioid epidemic, has so many dimensions and so many different modalities that it can be treated. I was really intrigued about your collaboration with the orthodontist. I had no idea that they also had these tricks up their sleeve. But I wanted to ask you, like, who are the patients? Are the patients being referred to you, or is there a way that the patient can directly access your clinic? What is the process for that?
Well, currently our process is that it's in-house. So they are being referred to us by the family medicine residents who are in their first, second, or third year of residency. And so it is contained within the center. However, as we're continuing to do this, we're finding so many people that are asking us, can we refer to you as they're learning about it from our practice or from other practices? We haven't started that yet for I'm not sure what reason, maybe because of the number of patients that we are seeing, because it does take us several hours to have that collaborative approach. In fact, one patient could be there, depending on the complexity of the condition and the comorbidities that the patient has, that we could be seeing that patient for up to 3 hours. Our goal is 1.5 hours to 2 hours, and not all of the disciplines are involved. It really depends. And we do a pre-huddle, and we talk about all the patients that are coming to the clinic that afternoon, and then we determine which providers really need to see the patient, but the team is always involved if a provider still isn't seeing that patient, because when we do our final huddle to determine our comprehensive plan, we make sure that everyone has a say in that. And it's a really neat opportunity for seeing the value and the respect that happens between us, and the synergistic approach of trying to really help the patient. Unfortunately, the patient isn't involved in that team approach, but the patient is number one on our minds, and making sure that we're fulfilling the needs of that patient's goals and trying to work with the patient while they're in the clinic. We then refer the patient back to that provider that they have been referred to us from. And we have a couple of options. We may see that patient back in the clinic, depending on if the physicians have started weaning the patient from opioid use, or if there's something else that wants to be watched during that time. We're also starting a follow-up clinic. So like myself, we don't have physical therapy that's practicing in that particular center, but although I have my license to practice physical therapy in our follow-up clinic, I want to make sure that that patient has been able to access physical therapy in the community. If they aren't, for a number of barriers, then I can assist them while they're in the clinic in the follow-up session. And we typically don't charge for that now. In the future, we're just looking at opportunities that we can actually help the patient where the finances and many of the other barriers are really mitigated for them. And they make that one visit and they can see all of us at one time.
Well, I know a question did come in about a website for COPAC. So April, I know Alex had to drop off to get to naloxone training he's hosting, but if you could add that to the chat, that'd be very helpful.
Okay.
I also want to remind, so thank you so much for being with us, and we look forward to talking with you next week at our next event. Well, thank you, April, and thank you, Alex, for being with us today and for that presentation. And for those who tried to watch it last week, hopefully you enjoyed the tail end of that presentation. That wasn't given in a live format, so we thank you for your patience with us as we work through that. So we'd love to open up the floor for questions. April and Alex are both joining us from the Bloomington area, I'm guessing, and are prepared to answer questions. So if you have a question, please put that in the chat window, or you can also unmute yourself and ask that now.
And just a heads up, we are back actually based out of the IUPUI Indianapolis area.
Sorry. So you're probably right down the road from where we are right now then.
Yeah, that's right. All good though.
Any questions, or Dr. Anwar, do you have a question to start us off?
I would just like to ask, I asked quite a bit of questions about the COPAC clinic last time, and you have mentioned that you guys have been thinking about how to reopen those. Have you guys reached a decision, or how you're moving forward with that? And I know I had presented this question last time as well, was that can this be expanded out from just like IU system when it comes to referrals?
Sure, thank you. Currently, we have reopened COPAC, and we meet on Friday afternoons. We start at 12:30 to make sure that all of our technology is working properly and we have everyone in place. It is a multi-hybrid, if that makes sense. We actually utilize telehealth, where we have some providers and their learners actually go in and visit with the patient via computer. So our medical assistant will place the computer in the room with the patient, and they will have that conversation. And then there are other providers that and/or learners that may join one of us. My learner happens to be Zooming in from telehealth. And so when I'm meeting with the patient, I'm literally holding onto the laptop while I'm visiting with the patient, unless I'm doing something hands-on, and so that she can see that conversation, and so that the patient can be comfortable in seeing her as well. So we have that component. And then there's that face-to-face component that there are sometimes our orthodontist, physician, and or myself, any one of us in any type of sequence may actually be visiting with the patient. So that clinic is up and operational, and we've been able to see patients. We're continuing to receive referrals from our own clinic there at the Family Medicine Center. But there's a part of me that wants to really be able to open that and reach out and have other referrals come in from the community. And because it is a residency training center, I think there must be something that precludes us from doing that. We've had some of those conversations. I'm not exactly sure what that situation is. So right now we do not have outside referrals. They all come from patients who have seen one of the providers in the clinic. The other outside referrals that we do receive, though, however, are from our pediatric population of patients. And we haven't opened our Well Child Oral Health Clinic just yet, but that's one where we have medicine and dentistry and dental hygiene are seeing the patients for their preventive measures, immunizations, et cetera, but they're also looking at their oral health and if they need fluoride or if they need to be referred to the dental clinic on campus, then they're referred there for any other type of treatment. And then our other clinic that we have that is also operational is our Transitions of Care Clinic. And that's the clinic that is purely team-based. All of our team members are in the Family Medicine Center, and those are patients that are or have been discharged from the hospital, and we're seeing them in respect to their follow-up. Have they contacted all of their referral folks to make appointments? Have they received the medications that were provided to them, or if their medications changed, have they been able to reconcile that with their medication kits, depending on how they're actually accessing their medication? So we're still working on it, and I think telehealth has given us a really great opportunity to expand. And I mentioned last week that one person, and you'll be able to hear shortly from Spencer Metcalf, one of our colleagues, so one discipline, I should say, he has brought us into the understanding of a peer recovery coach. And so we are looking for one or more peer recovery coaches, maybe to assist us in working with our patients, either on a volunteer type of situation or as just an educational situation. So it's a little bit about where we are today.
That's good, all good. So a lot is happening even with this I wouldn't say post-COVID, like we're in the midst of it still. So
Right.
in the middle of the pandemic. Another question that I had was that since you have the advantage of a residency program that you work with, but if there are other providers who want to replicate this team-based approach, what are the key points that you would want to point out to them, just as a first step towards this?
Yeah, and that's an excellent question, because the providers don't have to be the same. And really, you can start with a team of two disciplines. So if you have a physician and a physical therapist, or a physician assistant nurse practitioner and an MA, any way that you want to form that team is okay. And so it starts with the thought process of, first, what type of clinic do you want to have? And maybe you're not in a situation to be assessing patients with pain, but maybe you have, or you've noticed an increase in your patient population that have had stroke or a heart attack or a cardiac condition or something like that. And you want to have some type of extra clinic where you can pull in multiple providers and work together to actually help that patient lead a more full life and a higher functioning and quality of life. So it's a matter of what providers do you have, what is their knowledge and experience, and then what type of specialty clinic would you like to develop out for your particular clinic. The other aspect is, it doesn't even have to be a specialty clinic. It's really coming to the table and saying, we want to work with all of our patients as a team. And so we're going to talk with each other and develop care plans and develop comprehensive care plans that has the expertise and the eyes of multiple providers, although not all providers may be seeing this patient in a dyad. You may be seeing them separately, but you come together and you talk about the plan of care.
Thank you so much. And then Alex, I have a question from you. I know in addition to this, the curriculum that you guys have and the program that you guys have at the university, you're also involved with the IN Cares ECHO. Can you tell us a little bit about how these two you work together with them, or like how these two areas where you're essentially addressing the same population in just different ways, how do they go together?
Yeah, thank you, Amna. So in addition to helping manage the this Grand Challenge project, I also help lead the Indiana Community Advancing Recovery Efforts, which is a Project ECHO, which is a piece of the Project ECHOs that we do with the Indiana University School of Public Health, where it's a partnership with the Indiana State Department of Health as well, where we've identified 16 different counties throughout the state of Indiana that need various help and assistance with substance disorder and creating awareness with harm reduction. We have safety syringe discussions, things of that nature in these prospective counties. And these prospective counties are facing various challenges in relation to substance disorder, as many communities both in the state of Indiana and throughout the country. And we have these monthly meetings with our hub team where we go over best practices on substance use disorder related contents. The session is a 2-hour, 1-month session that's part didactic and then part case study, where these 16 various counties and communities present a case study to our hub team of experts, and they kind of take an approach and kind of go through different systems and different processes on how to approach things. So, for instance, we've had case studies on travel, some of the travel issues to access treatment for we had a good discussion yesterday about an app that tracks individuals that are overdosing and how to get them care and how to get them Narcan or naloxone treatments. So if anyone has any interest in the in-care session, please let me know. And how that relates to the Grand Challenge is really just trying to get an idea of what each county is facing, whether it's a lack of resources or assistance with resources, access to treatment centers, and being an advocate for communities, learning more about those communities, and then hopefully training our health science students here at IU so they're better prepared and equipped to go out into communities and help individuals with substance use disorder. So that kind of sums it up and where that overlap happens, where both with the Grand Challenge and in-cares, it's all about kind of finding needs in various counties, both rural and urban in Indiana, and seeing how we at Indiana University, with the School of Medicine and the School of Public Health, can offer assistance.
Thank you so much, Alex. Do we have any other questions from the audience?
Please feel free to unmute yourself. We currently don't have any in the chat, or if you would like to ask a private question, you're more than welcome to submit that to us through that red cap link that we've been showing throughout the day as well. But I do not see any or hear anyone unmuting. So thank you, April and Alex, for being with us today. We look forward to hearing from you next week at our last event, but thank you for being with us today and have a great evening.
Thank you, guys.
Hey, pardon me.
So
Can y'all hear me?
Yep.
Oh, wow. Hi there. How's everybody doing today?
Good. How are you?
Splendid. Thank you for asking. Hey, April, how are you?
I'm doing well. Thank you.
Thank you. So that recovery coach that you were talking about, what kind of qualifications is needed for something in that position or in that area?
I think what I may do is to stay on the. I know we're getting a reverberation. Can you guys explain Spencer's topic?
Yes. So Spencer Metcalf with IU Health, he presented last week, and that video will be going up at the end of the month about peer recovery coaches. Each program is a little unique, and I don't want to misrepresent Spencer's program because I don't know all the details personally at the top of my head. But peer recovery coaches are usually individuals who have a lived experience that can relate to other individuals who are going through and starting that recovery process. Usually they are lay trained, so they're not clinically trained. These are not psychiatrists, psychologists, but other individuals who do not come from the medical community, who then receive specialized training. And there's various different programs. Again, I don't want to say exactly what Spencer's program uses, but there are different approaches and trainings that they can have to better engage that individual, to have a peer that can walk through that process of recovery with them.
Yes, so Spencer's program is basically the IU Health program, where there's a virtual peer recovery coach hub in which the peer recovery coaches are connected at the ET with the patients through, I wouldn't call it telehealth, but virtually. So they have, they don't need to be actually there present at the ET to get connected with the patients, but a peer recovery coach is on call, which will be contacted by the ED providers, and then they will be connected to the patients. If you need more information, once we have that program up, I think you will be able to access that. But I think what April, we were having a lot of echo, but what you were trying to say is to also incorporate in your team-based approach the peer recovery coaches when we're talking with the patients that have pain issues, but then some might delve into the substance use and all of that. Is that correct?
I'm getting a nod, so
Yeah,
yes.
we're getting a nod.
Yes.
And
Thank you.
Yeah, and as for your question, like Cody mentioned, there are various different certifications which are provided by ICADA, which you need basically for the peer recovery coach certification and peer recovery specialist certifications. So that information can also be provided. If you need that, we can send it out to you.
Yeah, Brian, I believe you're the one who has that question. If you want to put your information in the chat window or go to that link, we can better connect with you after the event as well and help provide that information. Well, thank you to April and Alex. It looks like you both muted your camera right on cue. We did not plan it that well, but that was perfect. Third time the charm, right? Can we do a quick audio check with both of you?
Good afternoon.
Hey, good afternoon, everybody.
Yeah.
Wonderful. Well, thank you so much for joining us. You are one of the few presenters that are with us for each of the three. So we thank you for being the road warriors with us virtually for the last 3 weeks, enjoying Amna and I. So we'd like to open up this opportunity for questions. So anyone on the line, if you have questions, please be typing those into the chat window. Or please feel free to unmute yourself and ask those to Alex and April. And while we're waiting to see if any come in, Dr. Anwar, do you have a question?
I always have questions for Alex and April. So my question, I'll start with Alex today. You mentioned some of the workshops that you've held with the students when it comes to prescribing guidelines and screenings. Are those workshops only held for the IU students, or are you thinking about bringing them out to other rural communities within the health providers?
That's a great question, Amna. So usually with our workshops for future prescribers, we've tried to open it up to other universities and other students to increase kind of the interprofessional collaboration pieces. So for example, we had a workshop in spring of 2019 that was open to Purdue Pharmacy and Butler Pharmacy. So we're definitely open to working with other disciplines, other universities. And I think we'd be even open to working with individuals who are already prescribers, whether it be pharmacists or MDs, and maybe they can provide some advice to future students on how to collaborate. With COVID hitting when it did last spring, a lot of our plans for prescribing programming kind of got put on hold and put on pause. But we'd be open to any kind of educational pieces for future prescribers where they can get hands-on training or knowledge maybe that they're not getting within their curriculum, whether it be social determinants of health or a deep dive into chronic and acute pain. We're pretty open and we're pretty broad in terms of educating that group of students.
That sounds good. You just gave me an idea of collaborating further with InROC and with your program. So that's wonderful. I did want to mention though, like, are you thinking about moving some of this virtual? Like, have you guys thought about it with the students or with the prescribers, the ones who are already prescribing, or is that something that's not under consideration at this moment?
Yeah, and well, So we're in the process. So our grant wraps up in December, but we're also looking to pursue a no-cost extension. And part of during this extension period, if we're granted it, we'd like to explore how do you ensure that all this is sustainable. And we think doing online, a lot of the online work is probably that opportunity to make it sustainable. And we've noticed that the IU School of Public Health in Bloomington has done a lot of excellent work with some of their online modules. And we've started relationship building with some of the folks from the School of Public Health in Bloomington to see what do they have that's going really well, and what have we done that offers an opportunity to overlap, whether it be a certificate series online, or just additional programming online, or just recording some of our sessions. I think with COVID, we've learned that we need to leverage some of these online and technology opportunities that we have and see how we can create them to be sustainable. So that's definitely something that we have in the back of our minds and looking to work and develop as time goes on.
Sounds good. I think with COVID, everybody has found ways, or they have been forced to find ways to reach out to the stakeholders that they want to reach out to. So the technology has been a great tool in order to get out and get the message out. That's why we are virtual. Otherwise, we do these in person as well. Another question I had about this was that you mentioned dissemination. So you mentioned various different conferences that you have presented to, but are you guys also from the academic side, because you guys are working with the school, doing any sort of working on a publication of some sorts of the effects of this prescribing education to the future prescribers and other things that you're doing with the grant challenge?
You know, it's funny you mentioned that, Amna, because we just had a meeting last month to discuss, publishing and documentation, things of that nature. And our long-term idea is to develop a manuscript that's over-encompassing of the entire Grand Challenge. So if you recall from my my workshop presentation, well, not my from this presentation, I talked about the different arms of the project and just an over-encompassing view of what we've done and how those arms of the project connect. So we're working on developing that manuscript. But right now we have monthly recurring meetings to kind of check in and take the necessary steps to develop that document.
Sounds good. That sounds exciting.
Yeah.
So I will move to April now. April, I have asked you possibly all the questions that I could ask about your program, but I wanted to ask you one more for this presentation, is that how has COVID affected the participation by the patients? I know that you've moved telehealth and you did hybrid, but have you lost patients? Have you gained more patients? Are you seeing more patients who have pain? Like, how has that affected you guys?
That's a great question, Amna, because it's really hard to determine if it's the situation of the patient's condition or is it actually a product of, and I think it's really a mixture, because our patients had been continuing to attend to their needs with our family medicine residents. However, when we started back with our pain assessment clinic, we hadn't received some of the referrals, or I know a couple of weeks ago, we actually had a patient that became symptomatic. She wasn't sure if she was symptomatic of COVID or if she was getting a cold, etc. So she canceled. So those are some concerns that we've had with some of our patients. And the reason why we have become more of the telehealth provider and bringing the patient into the clinic, because as I've mentioned in one of my previous presentations, that's been a huge barrier for our patients to utilize the technology or to have the technology for us to do it the other way around. So we are averaging, and I know it doesn't sound like a lot, but we're averaging about 2 patients per Friday afternoon. But we also spend a fair amount of time with those patients. And it's really dependent upon the complexity of their situation and with their other comorbidities.
I was going to say that, like, even seeing those 2 patients would take up a considerable amount of your time for those Fridays, because these are extremely complex health issues that these patients come to you. I also wanted you to just repeat a little bit, because I was very intrigued about the orthodontist and how they play
Yes.
a role, because that was
Yes.
something that I had no idea about. And I was like, wow, I need to hear about that a little bit more.
Sure. Well, and since we last spoke 2 weeks ago, we actually have some dental learners that have joined us via telehealth after hearing about having one of their dental faculty members on board. So this particular orthodontist is really interested in more of shoulder, head, and neck pain. Notice I'm in the wrong spots, but shoulder, neck, and head pain. And he has really looked at his patients, a number of patients across many years, and determined this four-pronged type of intervention for them when they complete a form saying that they've had certain types of pain over a certain amount of time. And anything from shoulder pain to migraines to actually teeth, jaw pain. And in that four-pronged type of intervention, he does a trigger point injection. He has biofeedback and education, a mouth splint or a mouth type of guard, and a 5-day regimen of medication, and has found through that his patients coming back have reported, and a lot of this is anecdotal, and we're also working, you ask about dissemination of manuscripts, we're working on a pilot study with him on this, and then hoping to make it into more of a randomized controlled trial type of study to see if in fact we are getting the significant differences of that pain control. But it has been phenomenal in the work that he's been able to do. And he's one of few physician or dental physicians that has this type of approach.
That is so exciting.
And he's able to teach medical residents how to do, and if they're comfortable with the injection. So it's really neat how the education between learners and preceptors, providers actually is happening during the period.
Thank you so much. I know when we're talking about pain, there's just so many facets of it and how to treat it and how to bring different types of professionals in for the treatment. And I think your program has explained that in great detail. Thank you, both of you, for sticking with us for all these 3 events. And hopefully at our next events, you can present your findings of all the research that you guys are doing with us. Thank you. I appreciate it.
Absolutely.
And thank both of you so
thank
much.
you both.
Mm-hmm.
Thank you. So if you have any questions for April and Alex, please feel free to unmute yourself or put those in the chat. You can also send those in, and we'll definitely connect with April and Alex after the event if questions come to you as we go through the rest of our programming this afternoon.